So today we are going to talk about pathology. Now you may have heard that pathology for IMGs has become relatively easier over the past few years. However, you still need to show a dedication and commitment to pathology. You will need to do some US clinical experience. Research is always useful in pathology, and you'll need to show that kind of a dedication so that it does not come across as a backup specialty. We have a couple of blogs that I'll point you to the end of this discussion. But we also interviewed a Sarthi student who matched this year. She actually got a pre-match. So let's listen to her and see what her suggestions are on how, as an IMG with probably an older year of graduation and relatively lower scores, you can still make yourself a competitive applicant for pathology. All the best, and let us know if you have any questions.
Good morning, good evening, everyone, wherever you are in the globe. So today we have our student Buket, who took a pre-match in pathology, and we wanted to understand from her on what it takes to match in pathology. So before we do that, let's get some introduction. So Buket, welcome, and you want to talk a bit about your background and yourself?
Hello, Pawan. My name is Buket, and I'm originally from Turkey. And I came to US after I married my husband. And by the time I applied, I was actually an old grad, and I didn't have the highest scores. So I was very stressful and concerned. But luckily, I had a very good result. Thanks to you.
Oh, thank you. So tell us about the reasons you went for pathology. What were the driving reasons that you thought pathology would be a good fit for you?
Well, I think I love pathology because it's like a bridge between clinical and basic science, and I'm a kind of person who likes 2 plus 2 4. So that's why I really like pathology, whether it's there or not. It's pretty much close enough to definite, I think, in medicine as much as you can get. So that's what I really like, and I also like that pathology has so many fields inside, so many fellowship opportunities. That's something I
Mm-hmm.
really like. And also I have a research background. So I think pathology is a
Okay.
great field for someone who's interested in research.
So walk us through your journey on how did you prepare for pathology residency in terms of rotations, in terms of general getting the pathology experiences.
Well, I did rotations as a trainee and also as an observer. So I really think it helped me. And during my interviews, actually, we talk about them. So this was pretty much made me get used to the system, how pathologists work in the States. So that was really
Okay.
helpful.
And in terms of your US clinical experience, you did rotations. Did you also do any research in terms of any case reports or anything with research focus?
Well, I did the research 18 months in a university hospital, a very good
Oh,
university hospital. So it was very good because multiple interviews with university hospitals with research background that was actually mentioned multiple times. So it was actually really good because I got to meet a lot of people. So actually during the interview there was even common people we both knew with the interviewer. And it was a really nice, it kept the interview flowing. So I think research is a great opportunity if somebody has a time because it takes a long time. I did 18 months. So.
okay. Yeah, that may have really, really strengthened your application. Now, talk to us about your interview preparation. How did you prepare and what was the focus of your pathology interviews as you went through the match season? I know you had 10 plus interviews. So what was the focus of the interview questions?
Okay, so how I did prepare is I actually got help from USMLEsarthi because honestly, I had no idea how to study for interviews. In my country, we don't have interviews. You just take a test and get going. So I didn't know what to expect. So I actually studied your resources, which actually guided me. So honestly, I don't think there was any questions asked beside those resources. And I also practiced very experienced people at USMLE Step that kind of made me kind of calm down. They also kind of helped me with how to dress, what to dress. I know these are little details, but I really think it's important. Even like how to even make your hair, like, is it easier? Does it look right? Professional, you know? So these are important but little details, but very important, I think. And also for the content wise, those practices help me because when I thought I was giving an answer, I thought I was giving a fantastic answer. They're gonna love me. But then they actually gave me a different perspective. They're like, that's actually not a good way to answer it. So it really helped me. I also had multiple friends that I practiced with from different specialties because they had a very different perspective. So I think practice makes it perfect and work with the professionals who knows what they're doing.
Yep, yep. So on your interview trail and during the residency interviews, what was the focus of the interviews? What did they want to focus on from your CV, from your experiences? What was those interviews like?
I think the main reason they wanted to find out why I wanted pathology, like, was it my backup plan or was it actually really what I liked? And I think they really wanted to find out who I am and am I a good fit for their program? Because I think like one of the actually program director told me I can teach pathology to pretty much anyone, but I want to know if I can work with you for the next 4 years. And I think that's the key thing. Like, I fit in there, and do they fit with my character? So I think that's what I noticed mostly. Like they were trying to get to know me, my personality.
Yeah, you raise a very important point. You know, it's two things. One is the fit, and the second is they want to know if pathology is your backup or you're actually interested. That's something that we have seen over the years. You know, people who use it as a backup find it very difficult to match. You know, they look for that fit and that interest, I think.
Yeah, and I
Good.
think they want to
So,
find out if your application is focused on the pathology. Like
yes.
my research was actually on the clinical, and they wanted to find out why, but I explained them my research was on nephrology, and I told them I'm really interested in transplant and renal, which I want to advance my studies in that even as a pathologist. And actually, once they hear this, they knew that I was actually really focused rather than, oh, well, you know what, let me just apply everywhere, and which made so much sense. I think focus application.
You know, what is your advice to students who may be in similar situation that you were, slightly maybe older graduate, maybe scores on the lower side, trying to figure out if pathology is the best? So what should they do, you know, to strengthen their application and probably match into pathology? What specific advice do you have?
I think first they need to find out whether pathology is the right specialty for them because it's a completely different specialty. It's very different than clinical. So I think they need to do some rotations to see actually do they fit what actually pathologists do. And even the practice of pathology is very different. Like in my country, clinical pathology is not included in that. So it's very, very different.
Hmm.
Like they don't do autopsies in my country. Other specialties like forensic does it. So I think they really need to find out what pathologists do and actually see it in person during rotations to see if it's the right fit and maybe focus their application to just one specialty rather than jumping from specialty to specialty. I think that two key thing is the most important.
Hmm. Hmm.
And also I would like to
And
advise people like get help from professionals because you like even I did the same mistake. This was my second time applying, which you remember maybe. And my first time around,
yes.
my application wasn't good, and I didn't even know it wasn't good. So definitely getting a professional help my application to be more precise, much better. So that's very important, I think.
Anything that we missed? I know you covered a lot of ground in terms of doing research, doing clinical experiences. Talk about, I guess, a bit about the US experiences and the kind of LORs. You know, how important are good LORs for pathology?
Yeah, I actually think it's really important because when you do rotations with these people, I didn't get any of my actual interviews from connections, but multiple people actually made the phone calls. So I think if you perform very well, these people can really help you. And also, pathology is a small world. The world is very small already, and pathology is even smaller. So it's always good to perform your best so that you get a good recommendation letter. Like they already know that you don't know everything because it's very specific, very hard field. But if you actually show the effort that you're actually learning something, they really support you and they're very helpful. I think that's what I love about pathologists. They're very helpful people. Such a friendly environment.
Last question, how was the overall support from our team at USMLE Step, and how did it help you?
Well, it was a lot because, like applying is very stressful, especially like me, if you don't have I had below average scores and I was very stressful. It was my second time around. The first time I didn't even get an interview. So during that time, sometimes, like, I was calling, I was like, oh my God, I got one interview. Like, what am I going to do? How am I going to accept? Always someone to actually look for help is important. And also, like, some of the application parts, I didn't know how to write. Some little wordings can mean it's a lot of importance. Every little mistake you make. So I think that really helped my application to stand out from the crowd. Because, there's a lot of people applying and there's only a few of them being invited for interview. So everything matters. So that's how, like, sometimes being able to get this help when you don't know what to do, when you don't know how to write, or when you don't know how to even accept an interview because you never done it before. So it was very important, and I actually appreciate the help when I got the pre-match because it was a very tough decision for me. And like I was actually getting help from Dr. Mansour. He was my mentor, and he was a great help to answer all my questions about the American system, about how to approach during my even observerships. Like he actually helped me a lot how
Mhm.
to succeed, how to stand out. So that was amazing help.
All right. Thank you very much, Buket. I appreciate the time you took to help other applicants, especially with pathology interest, and all the best. We are very happy for you and look forward to your new journey and new phase of your life.
Thank you so much, Pawan. I really appreciate it, and I'm so glad I ended up with such a good result.
Yes, absolutely. All right. Bye.
Have a good day. Bye bye.